name is Nurse Engee. This topic is Parkinson's disease. Let's look at the pathophysiology of Parkinson's disease. When you think of Parkinson's disease, you think of progressive because it's a progressive neuromuscular disorder and it's going to be caused by a degeneration of dopamine neurons. And dopamine slows us down. Think of things that calm us down, maybe like chocolate. There's also an uncontrolled activity of acetylcholine. These are things that speed us up. So think of caffeine. When you have this imbalance of dopamine versus acetylcholine, you get this formation of abnormal proteins called Lewis bodies. And these are going to affect us cognitively and muscularly. What are the clinical features of Parkinson's disease? Because Parkinson is a neuromuscular disease, there is imbalance between the dopamine and acetylcholine, which is going to lead to a tremor. And this is going to be a resting tremor. You might see some rigidity of muscle, akinesia, meaning no movement, or a freezing versus bradykinesia, which is slow movement, as well as some postural instability. When you think of Parkinson's, think of a snowflake because every single patient is going to be different. Hallmark signs are going to be the tremors that have been previously mentioned, especially pill rolling. What does that mean? You may ask. Picture your hand and you're actually rolling a pill in that hand. That kind of tremor. Clinical features also include a shuffling gait, that loss of voluntary movement, akinesia or freezing. You have to make sure to have patience with these Parkinson patients. A mask-like facial expression because their muscles are hard to control, even in their face, and then that stooped posture that can lead to kyphosis, as you can see in the image. What are the complications of Parkinson's disease? One of the complications will be the fall risk and orthostatic hypertension. That will be a reason because of the smooth muscles that lines our vessels. Postural instability, they could have dysphagia. We often think about large muscle groups, but also think about the muscles in your neck. This would lead to malnutrition, problems swallowing, as well as aspiration. They are going to be constipated because of smooth muscles in our GI tract. They would have sleeping problems and may be restless, especially with their legs. Parkinson's patients often are depressed, so look out for therapeutic communication. Look out for dementia as well because of these Lewis bodies. What are the nursing interventions? These Parkinson patients are going to need medication to replace dopamine. Think about the pathophysiology. We have a lack of dopamine and we must replace it. For prevention, we're going to take conscious larger steps and we need to remind these patients to swing their arms for stability so they don't fall. Parkinson's patients need to wear non-skid socks or shoes so they don't fall. Also, remember to remove area rugs. They can also use assistive mobility devices such as cane or walker. Again, if they need to use the bathroom, like an elevated toilet seat is required. Expect physical therapy to be consulted because these patients need to have muscle building exercises. Other nursing interventions are going to include nursing actions for dysphagia or malnutrition. So we are thinking speech therapy for a swallow evaluation as well as a high-calorie, high-protein diet. They need to eat frequent smaller meals. Remember, they have weaker muscles in their throats. We need to provide ample uninterrupted time and have patience for these clients. For constipation, we need to encourage them to drink a ton of water, and we need to add fiber and vegetables to their diet. So meal planning should be encouraged. Expect case management to be consulted for a Parkinson patient. This is because we have to take care of the patient, but also the family. Because as you can see, we need to make sure there are coping strategies for these patients. This ends to this topic, Parkinson disease. See you next time. Bye.